Do you suffer from edema, hypertension, heart failure, or a kidney disorder? If you or a loved one suffers from one or more of the following conditions, diuretics may help treat these conditions so you can improve your lifestyle. Diuretics are used to help the body excrete excess water through urine output, which in turn helps improve conditions like high blood pressure, preload, and excess fluid buildup in the limbs. Fluid buildup in the body can be associated with heart failure and can cause edema, weight gain, and shortness of breath. Diuretics stimulate the kidneys to excrete more sodium in the urine, thus resulting in decreased blood volume. The decrease of blood volume then results in less pressure being exerted on the arterial walls. Diuretics help alleviate these problems by reducing plasma volume, which can reduce the fluid buildup. There are several types of diuretics such as thiazides, loop diuretics, potassium-sparing diuretics, and aldosterone receptor blockers that each affect different parts of the nephron loop. Thiazides work by inhibiting sodium chloride reabsorption within the kidneys. These cause moderate increases in water secretion and are appropriate for long-term use. These are especially used for individuals with high blood pressure, which increases the risk for stroke and heart attack. Loop diuretics work in a similar way to thiazides, in which they inhibit the body's ability to reabsorb sodium, which leads to an excretion of water in the urine. These forms of diuretics elicit a much greater response of water secretion and primarily used in emergency situations. These diuretics are primarily used for individuals suffering from heart failure. Potassium-sparing diuretics work by preventing the loss of potassium, which is a problem other diuretics have on the renal system. These types are used for long-term use because of their ability to retain potassium and is sometimes used in conjunction with other diuretics. It is important that you speak to your doctor to find one that's best for you. By taking diuretics, it is advised that you should limit salt intake to 2 to 3 grams per day and restrict any alcohol intake as well as general fluid intake. Taking diuretics also can put your body into a state of hyperkalemia, hyponatremia, or hypercalcemia. Fatigue, muscle cramps, heart palpitations, dizziness, anorexia, numbness, induced vomiting, constipation, pancreatitis, depression, loss of sex drive, menstrual changes, breast swelling, shock due to increase of blood volume, and renal dysfunction are possible side effects of taking diuretics. Call your doctor if you are having trouble breathing, elongated coughing, if you have swelling that occurs at the feet or legs, if you are gaining or losing weight rapidly, if you are experiencing abdominal pain, and if you are experiencing arrhythmias such as lack of a steady heartbeat.
Created using Powtoon.